Let me ask you something most women are afraid to Google. What really happens to your vagina if you don't have sex for months or even years? Does it tighten? Does it weaken? Does something go wrong? Because the truth is, a lot of what we've been told about the female body is completely wrong. If you're not sexually active right now, by choice, by circumstance, after childbirth, during menopause, because of stress, trauma, or simply because life is busy, this video is for you. I'm Dr. Maya from Vital Core, and today we're talking about what actually happens to the vagina in the absence of sex, medically, hormonally, and emotionally. No shame. No fear-based myths. Just real science and practical care. Because your vaginal health does not depend on whether you're having sex. It depends on how well you understand and care for your body. So let's separate fact from fiction and give your body the respect it deserves. Before we talk about what happens when there's no sex, we need to understand what the vagina actually is, because most myths come from not knowing how this organ works. The vagina is not an empty space, and it is not a fragile tunnel that collapses without use. It is a living, elastic, muscular canal made of layers of smooth muscle and soft tissue. These muscles are designed to stretch, contract, and adapt throughout your entire life, during menstruation, exercise, medical exams, childbirth, and yes, sex. One of the most important things to understand is that the vagina is naturally closed at rest. The walls gently touch each other, which helps maintain moisture, healthy bacteria, and protection against infection. So when people say, if you don't have sex, the vagina closes, that statement is both misleading and biologically wrong because it's supposed to be closed when not in use. Another major myth is the idea of tightness. Tightness is not about sexual activity or inactivity. It's about muscle tone and flexibility, which are influenced by hormones, stress, posture, breathing patterns, and pelvic floor health, not by how often someone has sex. It's also important to separate the vagina from the vulva. The vulva includes the external parts you can see, the labia, clitoris, and vaginal opening. Many changes people blame on not having sex are actually changes in the vulva caused by hormonal shifts, skincare habits, or irritation, not the vagina itself. Here's the key truth. The vagina is a self-maintaining organ. It cleans itself, maintains its own pH, and protects its internal environment through healthy bacteria and natural secretions. Sexual activity does not keep it alive, and abstinence does not harm it. Understanding this foundation allows us to move forward without fear, because once you know how resilient and intelligent your body is, the myths lose their power. What does not happen when you don't have sex? One of the biggest fears women carry, often silently, is the idea that not having sex will somehow damage the vagina. Let's clear this up with facts, not fear. First, the vagina does not shrink or permanently tighten if you stop having sex. The vaginal muscles may feel slightly firmer at rest, but this is not damage. Muscles don't lose their ability to stretch simply because they haven't been used for penetration. Just like your mouth can open wide even if you haven't eaten a large sandwich in years, the vagina retains its natural elasticity. Second, the vagina does not forget how to have sex. There is no muscle memory loss related to sexual inactivity. When arousal occurs, blood flow increases, tissues soften, and the vagina naturally lengthens and expands. This response is controlled by the nervous system and hormones, not by sexual frequency. Third, abstinence does not cause infection. In fact, for many women, periods of sexual rest can reduce irritation or recurrent infections. The vagina's healthy bacteria, primarily lactobacilli, remain active whether you are sexually active or not. Another common myth is that the vagina becomes weak without sex. Sexual activity is not a pelvic floor exercise program. Some women who are sexually active actually have overactive or tense pelvic floor muscles, which can cause pain, tightness, or difficulty with penetration. So more sex does not equal better muscle health. It's also important to say this clearly. Not having sex does not reduce your value, femininity, or womanhood. These harmful beliefs are cultural, not biological. The female body is designed to go through seasons, sexually active phases, sexually quiet phases, healing phases, and all of them are normal. Your vagina does not punish you for resting. changes that may happen, and why sex isn't the cause. While not having sex does not harm the vagina, there can be subtle changes some women notice over time. What's important to understand is this: these changes are rarely caused by the absence of sex itself. They're usually driven by hormones, stress, health, and life stage. One of the most common changes is reduced natural lubrication. Many women assume, I'm dry because I'm not having sex, but that's not how the body works. Vaginal lubrication is influenced mainly by estrogen levels, hydration, blood flow, and nervous system regulation. Stress, lack of sleep, breastfeeding, certain medications, and menopause all affect lubrication, regardless of sexual activity. Another change some women notice is a difference in pelvic floor muscle tone. Without awareness-based movement, pelvic floor muscles can become either slightly weaker or overly tight. Neither is caused by abstinence, it's caused by posture, sitting for long hours, clenching due to stress, and not engaging in relaxation or strengthening exercises. You may also notice changes in arousal response. If you haven't felt desire in a while, your body may take a little longer to respond when stimulation does occur. This doesn't mean something is wrong. Desire is not a switch. It's a process that responds to emotional safety, mental presence, and physical comfort. Some women experience vaginal dryness or sensitivity, especially during hormonal transitions like postpartum or perimenopause. Again, this is not the vagina missing sex. It's the tissue responding to lower estrogen support. Here's the key message. Your body responds to how supported it feels, not how often it's penetrated. Hormones matter more than sex. If there is one factor that influences vaginal health more than anything else, it's hormones, especially estrogen. Sex does not regulate estrogen. Your ovaries, adrenal glands, brain, and overall health do. Estrogen plays a critical role in keeping vaginal tissue thick, elastic, well-lubricated, and resilient. When estrogen levels are healthy, the vaginal walls maintain good blood flow, natural moisture, and a balanced pH that protects against irritation and infection. When estrogen drops, which can happen during breastfeeding, intense stress, rapid weight changes, perimenopause, menopause, or after certain medical treatments, the vagina may feel drier, more sensitive, or less flexible. These changes often get incorrectly blamed on not having sex, when in reality, they would occur even in sexually active women with low estrogen. This is why two women can have completely different experiences. One woman may not have sex for years and feel perfectly comfortable, while another may be sexually active and still experience dryness or discomfort. The difference isn't sexual frequency, it's hormonal support. Stress hormones like cortisol also play a role. Chronic stress tells the body it's not safe to focus on reproduction or pleasure. Blood flow shifts away from the pelvic area, and arousal responses can become muted. Again, this has nothing to do with whether you're having sex, and everything to do with how supported your nervous system feels. Understanding this is empowering. It removes blame and replaces it with clarity. Instead of forcing yourself to be sexually active for health, the focus shifts to supporting hormones, reducing stress, and caring for the body holistically. The emotional and psychological side of sexual inactivity. Vaginal health is not just physical, it's deeply connected to the mind, emotions, and sense of safety in the body. When sex is absent, what changes most often isn't the vagina itself, but the relationship you have with your body. Many women internalize the belief that not having sex means something is wrong with them, that they're broken, undesirable, or falling behind. These thoughts create tension, not only mentally, but physically. The pelvic floor responds to emotions like anxiety, shame, and fear by tightening, which can later be mistaken for a physical problem. Desire and sexual activity are not the same thing. You can have low desire and be healthy. You can have desire and choose not to act on it. Periods of low or absent sexual activity often happen during grief, stress, healing, caregiving, postpartum recovery, or personal growth. These are not failures, they are transitions. Another important point is body awareness. When sex is absent, some women feel disconnected from their pelvic area, while others feel more in tune with themselves. Neither response is wrong. What matters is maintaining a sense of curiosity and kindness toward your body instead of pressure. Pleasure is also not limited to partnered sex. Touch, movement, breath, relaxation, and self-care all influence blood flow, nerve sensitivity, and comfort in the pelvic region. The body does not require intercourse to remain responsive. It requires safety and presence. Your vagina does not judge your choices. It responds to how gently you treat yourself, how well you rest, and how safe you feel in your own skin. How to maintain vaginal health, with or without sex. Vaginal health is not something you earn through sexual activity. It's something you support through daily care and awareness. Whether you're sexually active or not, these habits help keep the vagina comfortable, resilient, and healthy. First, let's talk about the pelvic floor. These muscles benefit from both strength and relaxation. Gentle pelvic floor exercises like mindful Kegels combined with full relaxation help maintain tone and circulation. Just as important is learning to release tension through deep breathing, stretching, and posture awareness, especially if you sit for long hours or carry stress in your body. Next is moisture support. If you experience dryness, vaginal moisturizers can be used regularly to support tissue comfort. These are different from lubricants, which are used during sexual activity. Using a moisturizer does not mean something is wrong. It simply supports the tissue, especially during hormonal shifts. Hygiene matters, but simplicity is key. The vagina cleans itself. Avoid douching, scented washes, or harsh soaps. Clean only the external vulva with lukewarm water or a mild, fragrance-free cleanser. Overcleaning disrupts healthy bacteria and can cause more problems than it prevents. Lifestyle habits also play a role. Staying hydrated, eating nutrient-rich foods, managing stress, and getting enough sleep all support blood flow and hormone balance. Wearing breathable cotton underwear and avoiding prolonged damp clothing helps maintain a healthy environment. Finally, listen to your body. Discomfort is not something to ignore or push through. Vaginal health thrives when the body feels respected, not pressured. When to seek medical advice. Most changes related to sexual inactivity are completely normal and harmless. But it's important to know when your body is asking for professional attention, not out of fear, but out of care. You should consider seeing a healthcare provider if you experience persistent vaginal dryness that doesn't improve with basic self-care or moisturizers. Ongoing dryness can sometimes indicate hormonal changes that may benefit from medical guidance, especially during perimenopause or menopause. Pain is another sign to take seriously. Pain with tampon use, pelvic exams, or attempted penetration is not something you need to push through. It can be related to pelvic floor tension, low estrogen, inflammation, or nerve sensitivity, all of which are treatable when properly addressed. Watch for itching, burning, or unusual discharge, particularly if it has a strong odor, unusual color, or is accompanied by discomfort. These symptoms are not caused by not having sex and should be evaluated to rule out infection or irritation. Bleeding that is not related to your menstrual cycle, especially after menopause, should always be checked. While many causes are benign, bleeding is a signal that deserves attention. Also pay attention to changes in sensation or awareness. Feeling numb, disconnected, or persistently uncomfortable in the pelvic area can be linked to stress, trauma, or muscle dysfunction, and help is available. Seeking care does not mean something is wrong with you. It means you're listening to your body instead of ignoring it. Vaginal health is healthcare, not something to be embarrassed about. Let's end with the truth every woman deserves to hear clearly. Your vagina does not need sex to stay healthy. It does not weaken, shrink, or lose its worth when sex is absent. And it does not measure your value by how often you're touched by someone else. The female body is intelligent and adaptive. It moves through seasons of intimacy, seasons of rest, seasons of healing, and seasons of rediscovery. All of them are normal. All of them are valid. Sexual inactivity is not a failure, a problem, or a condition that needs fixing. For many women, it's a conscious choice. For others, it's part of life transitions like motherhood, stress, loss, recovery, or self-growth. None of these mean your body is falling behind. Vaginal health is about support, not pressure. It's about understanding hormones, managing stress, respecting boundaries, and listening to what your body is communicating, not forcing it to perform for the sake of a myth. When you remove fear, the body relaxes. When you replace shame with knowledge, confidence grows. And when you care for your body with patience instead of judgment, health follows naturally. If this video helped you feel more informed, reassured, or empowered, share it with someone who needs to hear this message. Subscribe to Dr. Maya Vital Core for honest, science-based conversations about women's health, without fear, shame, or misinformation. Your body is not broken. It never was.